So from here, we're just going to shift the hips left to right. Excellent. And then we're going to come into hip circles. So kind of like we're hula hooping, tracing a circle. And then we're going to reverse. Excellent. From here, we're going to do a bit of a hip hinge with a forward fold. So standing feet hip width, soft bend through the knee. You're going to let yourself hinge forward. You can use your legs or not use your legs. And then let yourself round. At the bottom here, shift the hips from the left to the right. Gonna try and relax as much as you can. Knees are still softly bent. Excellent. From here, we're going to come onto our bum, onto the floor. So we are going to get right into our 90-90 position. So as you can see, my knee and hip and back knee and ankles are all in 90-degree angle. This is quite a demanding position, so if you need a little bit of a modification, you can sit on a pillow or two. So it'll just prop your bum up. You can also bring your feet in as well. Let's all start in this position actually with the feet in, just so that we are nice and warm and ready. So from here, we're going to rotate our torsos so that our belly buttons are over our front thigh. Feet are tucked in. And then with a nice tall spine, we're going to hinge forward. So don't allow yourself to fold. You want to stick your tail feather out, not tuck it in. So we're hinging through that front leg, belly button over thigh. Take a couple big breaths in and out. As you breathe out, maybe hinging further. Good, then you're going to push yourselves back up and rotate over the back hip. So this is the more intense hip usually. You're going to grab a hold of your back shin and side bend over that hip. Trying to find the angle where you feel the most sort of, I don't want to say stretch, but where you feel the most within that hip. And you're going to hold there and breathe. Good, slowly come up. We're going to peel ourselves out of that position and switch sides. So with the feet tucked in, nice tall spine, belly button over the front thigh. We're hinging. Sticking the tail feather out, not tucking it in. And we'll take a couple big breaths here. Trying to relax with each breath out. Hinging further with each breath out. Good, bring yourselves back up, and then we're angling over that back hip. Really just trying to load it. It's a gross sort of sensation. If you feel like you're going to cramp, try and bear with it. Try and breathe through the cramp. So we're just going to hold. Good, now that the hips are a bit warm, we're going to come into swivel hips. So hands are behind, feet are wide. So this is called a bear position. So from here, you're going to let your knee fall, both knees fall. And then you're going to open the back leg as far as you can. Other leg follows when it has to. Open the back knee. Other leg follows when it has to. So you really want the motion to come from your actual hip joint and not through the momentum of swinging your legs. If you find that's pretty easy, you can give it a try without holding. So arms out in front. Again, peeling the leg open. Other one follows. Excellent. So now we're going to come onto all fours for some cat-cow. So we're just going to do full spine cat-cow today. So knees are under hips, hands are under shoulders. And we're going to let the spine sink, tail feather kicks out, face is wedged, ribs are open. And then we're going to tuck our chin, round our backs, tuck the tail, push the spine up towards the ceiling. Good, then coming back down into extension or cow. And up into cat. Push the floor away, tuck the tail around the back. Big breath in, come down into extension or cow. And breathe out, tuck up into cat or flexion. We're going to do a few more using your breath. Breathe in, extension. Breathe out, flexion. Breathe in, extension. Breathe out, flexion. Good, so from here, keep your hands where they are, but you're going to shift your bum back, potentially feeling a stretch through your low and mid back. We're just kicking back into child's pose, modified child's pose. So knees are wide, feet are together, hands are in front. So from here, we're going to challenge our spinal rotation today. So usually we do this in a quadruped position where we're up on all fours. But we're going to sit in this position and do our thread the needle. So hand comes behind the neck, twisting through the spine, and then you're reaching through the space between your hand and your knee. And come back, breathe in on the way up, breathe out on the way down, breathe in on the way up. Breathe out on the way down. That opposite elbow can bend to allow your shoulder to come closer to the ground. One more. Breathe in on the way up. Breathe out on the way down. Good. Switching sides. Hand behind the head. Twisting through the torso. One direction, then threading the needle to twist in the opposite direction. Breathe in on the way up. Breathe out on the way down. 3 more. Good, awesome. If we still are okay on our knees, if your knees or ankles are bothering you, you can put a pillow under your bum as well. or like a foam roller or something that's gonna prop you up a little bit. So from here we are gonna do some neck cars. So again, cars just stands for controlled articular rotations. We're tracing a big circle with our neck. So hands are planted firmly on the ground. Shoulder blades are pulled down and back, so your spine is nice and solid. And then from here, we're going to tuck the chin to the chest. Roll the chin along the left collarbone to look over our shoulder. Slowly come into extension. Wrapping the head around to the opposite collarbone. Tracing it back to the middle. Keep going. Rep 2. We're going to do 3 each direction. Shoulder blades are packed down at all times. If you're hearing snapping, cracking, popping, and feeling pulling, that is typical. If you're getting a sharp shooting, stabbing sensation, that is not typical. In which case, you want to avoid that range of motion. So smaller circle. So that is 3. We're going to switch directions. Check to make sure that your shoulder blades are packed down and back. And we're continuing to breathe. Focusing on this circle. Being greedy with it. Trying to take as much motion as we can with each repetition. I've lost count, so I'm just going to do one more. I think this is 3. Good, and from here we're going to do some more T-spine work. So push the floor away, tuck the chin, round the back. Pull the floor into you, shoulder blades down and back. Wedge the face. So we're not looking up, we're wedging, like someone's putting a pie in our face. And then we are pushing the floor away, tucking the chin, rounding the spine. So this is just cat-cow for the thoracic spine. And then pulling the floor in, shoulder blades down and back, wedge the face. One more each way, push the floor away, tuck the chin, round the spine. Pull the floor in, shoulder blades come down and back, tuck the face. Good, so we're just going to finish with some breathing for a couple minutes here. So sitting on our bums, cross-legged, in a straddle, whatever is kind of comfy for you. If you can't comfortably sit on the ground, feel free to grab a chair and sit in it or on the couch. So I want everyone to find their the most lateral aspect of their ribs. So kind of mid-thorax. Hands are splayed as much as you can to feel as much surface area. So we're going to take a big breath in. These are not just diaphragm breaths, these are rib breaths as well. So as you breathe in, I want you to try and expand your rib cage out. And then as you breathe out, everything kind of depresses and comes back to starting point. So with the hands on the ribs, we're going to take a big breath in through the nose, out through the mouth. So big breath in for 4 seconds. And out for 4. In for 4. And out for 4. Good. In for 3, 2, 1. Out for 3, 2, 1. In for 3, 2, 1. Out for 3, 2, 1. In 6, 5, 4, 3, 2, 1. Out 4, 3, 2, 1. In 6, 5, 4, 3, 2, 1. Out 4, 3, 2, 1. In 6, 5, 4, 3, 2, 1. Out, 4, 3, 2, 1. In, 4, 3, 2, 1. Out, 6, 5, 4, 3, 2, 1. In, 4, 3, 2, 1. Out, 6, 5, 4, 3, 2, 1. In, 4, 3, 2, 1. Out, 6, 5, 4, 3, 2, 1. Breathing on your own, as big of a breath as you can take in, expanding all of the ribs, even the upper ones here, maybe holding at the top for a couple seconds, and through the mouth, letting it all out. And again, great big maximal breath in, lifting all the ribs, filling all the spaces you can, holding at the top for a couple seconds. When you need to, letting it all out. One more big breath in, filling everything you can. Maximal expansion, holding at the top, and letting it all out. Excellent. Good job, you guys.